Hi guys, welcome to the podcast and thanks for joining me today. So in today's session, we're going to talk about something a little bit different, which is something I'm quite passionate about myself, although I dread it half the time and then crave it the other half, and that is cold water exposure or cold water shock therapy. There's lots of different names for it. People call it cold water therapy, cold water immersion, ice shock therapy, all that sort of stuff. So I suppose in recent years, the science around cold water therapy or ice baths and that sort of stuff has evolved at quite a fast rate. And you see popular personalities like Wim Hof, Wimhof, I think his name is, who's a Dutch guy who's done all these sorts of amazing feats, like climbing most of Everest, if not, did he climb all of it? No, maybe his base camp with like a pair of shorts, just to show that the cold wasn't getting to him. And also bringing a group of patients through just an incredible experiment he showed, where he got himself to a point that his immune system from doing cold shock therapy and Wim Hof breathing exercises as well, his own patented version of breathing exercises, could build up your immune system to a point that he said he could be exposed to an endotoxin. So he got injected with essentially a poison, something that should really shut down the body and cause you to be very, very sick, and had zero reaction to it because his immune system was so strong. So the researchers, it was somewhere over in the States, I think it might have been UCLA, said, let's take a look at this, but I want you to do it with a variety of patients. Is that something you'd be interested in doing? Now, I don't know how they got ethical approval to run this study because it's not easy to get approval, but he got a group of about 15 or 20 people, and one guy was in his late 70s and got them to do the breathing exercises and the cold shock therapy to build up their immune system, injected them in a hospital setting, or the hospital staff did, with an endotoxin, which should have caused all of them to be very sick for a week. Nobody had any symptoms, which is wild, just absolutely wild. So cold shock therapy, I suppose, when you look at the sum of the clinical literature of the last few years, it's been shown to ramp up your immune system, be really good for your metabolism, be really good for cognitive performance, resilience, reducing inflammation, all that sort of stuff. I've been doing it for a few years. I'll go into my own routine shortly. And the kind of journey you have to go on to get to that point, because it is tough. I always say to my wife, it's the toughest thing that you do every day. It really is. You look at the rest of your day and you go, that meeting is no problem. That talk later on is no problem, because that was brutal. Just in terms of the psychology of convincing yourself to do it. And you get to a point where you start off spending 10 or 15 minutes psyching yourself up and putting the kettle on and walking around the house and folding the clothes because you just don't want to jump into the ice bath. You get from that to, honestly, literally, and I don't mean this as a kind of a thing to say to sound cool or anything like that, you get to a point where you crave it, where you kind of need it, and you're thinking, God, today is a day off, but I'd love to do it today as well. It's amazing, actually. So let me just share this for a second. Okay, so first of all, let's just look at the benefits of cold plunging. I want to take myself out of the shot. How do I do that? There we go. Okay, so the benefits that we've known over the last number of years are immune system support. We know that if you expose yourself to cold shock ice baths, you're going to ramp up your immune system way more, and I mean way more, than any other supplement that claims it boosts your immune system can do. It increases blood flow. Initially, it restricts blood flow because it wants to keep the blood in your organs and not let it out. And it's really, really good for your endothelial function as well, for lowering blood pressure. Reduce chronic pain. We know that because if you have injuries and you go into an ice bath, it reduces down inflammation. Boosts your metabolism, and the reason it does that is through activation of something known as BAT, which stands for brown adipose tissue, which is a metabolically active type of fat. So basically, it causes your metabolism to need to speed up because it's metabolically active, in a similar fashion to how having more muscle mass does it. Better sleep, that's particularly if you do it earlier on in the day, because it's in line with what's known as your circadian rhythm or your circadian clocks. Boosting energy, elevating mood, stress relief. Obviously, you're practicing discipline and resilience. This is something that I find I've had a real tangible benefit around this. I remember listening to I'm not sure if you're familiar with them, but I think he's certainly a professor and a psychologist, Jordan Peterson, who's really, really hit the mainstream over the last number of years. I've been listening to him for 5 or 6 years. And he always says, start your day with something that makes you just slightly proud, even if that's dressing your bed, going for a walk, because that dopamine release, the release of dopamine when you achieve something that you had set out as a very small task, triggers more dopamine seeking behavior. So basically, if you dress your bed in the morning, if you clean your room, that's his kind of famous expression, start by cleaning your room. make your bed in the morning. It has this kind of trigger effect where your body says, "Got that release of dopamine felt good, do something else." This is why, if you've ever wondered why, I always relate it to this, to cleaning the house. If my wife says to me, "Any chance you put on the dishwasher?" and I go, "Oh, I really don't want to put on the dishwasher," she could come out 45 minutes later and I'm still cleaning, because you just get that kind of a feel-good feeling. She might argue I don't do that all too often, but you get this kind of dopamine release from dressing the bed, from loading the dishwasher, from folding the few clothes. And then you go, this kind of feels good, and it triggers those dopamine-seeking behaviors again. That's why if you start cleaning, it's very unusual that you stop 10 minutes in. You'll usually drive on for half an hour, or end up cleaning half the house. So elevation of mood, and the elevation of mood is system-wide. It's system-wide, so it's not just it causes a spike of dopamine, because if anyone knows anything about cold water exposure, there's a 400% increased release of dopamine and a 200 and something percent increased risk of serotonin. Now, if you look at antidepressant medications, cold water therapy blows them out of the water. The really interesting thing actually about serotonin treatment of dopamine was there was a serotonin hypothesis. And the serotonin hypothesis basically said that the reason you're depressed is because there's some sort of a chemical imbalance in the brain. More specifically, you haven't got enough serotonin, so we need to give you medications that will stop your body uptaking the serotonin that's in the brain and in your blood and in your system, and keep more of it for your brain. So there's a development of drugs known as SSRIs, which are selective serotonin reuptake inhibitors. So a selected amount of serotonin will be kept to go to the brain instead of going around the rest of the body. So it's stopping the reuptake of serotonin. These drugs were developed based on the serotonin depression hypothesis, which stated that people with depression have lower levels of serotonin. One study that showed that. And now all of the literature over the last 10 years has shown that's not true. People can have major suicidal ideation, horrible, crippling depression and anxiety, and have perfect levels of serotonin, which would make sense, because if you look at the literature on antidepressants, it is frightening how much they're prescribed relative to how little they do. There are studies showing that they're not much better than placebo, numerous studies over the last number of years. So it's amazing to see a 400% increased risk in increased production of dopamine, serotonin, and boosts in mood. I'll show you, I was inspired to do this talk because of a study I read a couple of weeks ago. I'll show you the mood ones, and most of this talk actually is going to pertain to mood. But the resilience is a really interesting one, because when you do something that you had a hesitancy to doing, your brain kind of fires into this let's do something like that again sort of a thing. And I genuinely notice a difference between when I'm doing ice baths and my productivity and lack of procrastination if I've done an ice bath. The difference is incredible, actually. So it's almost like your body says, if you do something that you didn't want to do, say, for example, you are sitting there going, I'd rather exercise tomorrow, but you get up and you exercise anyway, you're way more likely to do it the next day, because you realize it wasn't as bad as you thought it was going to be. And that hesitancy was a sort of a self-preservation technique from an evolutionary standpoint, and that you overcame it and you could easily do it again the next day. So the resilience is a very real thing. Now, we know it reduces muscle soreness and lowers inflammation, and as a knock-on effect to that, it will boost your performance. Nervous system regulation is also something we might talk about in a minute. But this is the study that I wanted to bring to your attention. The study is known as short-term head-out whole body cold water immersion. Now, let me just break that down. So short-term, less than 4 minutes. Head-out, you don't have your head underneath the ice or underneath the cold water. Whole body cold water immersion means from your neck down was submerged. Broadly speaking, if your shoulders are under the water, it's referred to as head-out whole body cold water immersion, which is what I do. I generally drop under the ice for 10 or 15 seconds and come back up as well, but it's nasty because you can get a little bit of a headache as well. Facilitates positive effect and increases interaction between large-scale brain networks. So this is the kind of breakthrough study. So let me show you what it found first, and then we look at the exact scores that came out from the study. So the results of self-reported mood questionnaires showed a significant increase in positive affect, so basically feeling good, good mood, mood regulation, scores of depression. They use kind of depression scales, standardized depression scales, and a decrease in negative affect after cold water immersion. Now, the incredible thing about this was, first of all, they used all females in the study, which is unusual. You'll often see studies that use all males, so it's lovely to see a female study as well. But the really interesting thing was it was after one session. So this is not, 12 weeks of, and people start to notice an increase, an uptick in their mood. Can you imagine if we had a medication that give you the sort of results that I'll show you in a second from one 4 to 5 minute cold water exposure session? And this is not the first time. This finding is well aligned with 2 major previous studies that reported acute positive changes in mood following a single immersion in cold water. So one cold water session. Okay, so let's look at what they actually found in the study. And I'll keep this one brief, guys. I'll only go for another 5 minutes or so unless anyone has questions. But basically what they did was they used something known as the PANAS, a PANAS, which is a kind of a depression and anxiety self-reported scale. Now, if you look at the green and the kind of purple bars here, the green is afterwards and the purple is before. So beforehand, afraid was scoring, a kind of a 2 on a scale of 1 to 5, how afraid somebody felt overall. That reduced by about 70%. After one session, they were 70% less afraid in general of whatever it was. This is because of the rewiring that happens in the brain. Classing themselves as active went up, and brain activity in all good regions went up. Jittery was down by about 50%, attentive up by about 40%, determined up by about 15%, nervous, interestingly, and this relates very much so to anxiety. Nervousness dropped dramatically. I mean, a 90% drop in nervousness. Feeling inspired, up quite a bit. Feeling ashamed, interestingly, 50% drop. Alertness way up, irritability way down, pride way up, enthusiasm up. Hostility reduced by about half. So if you were feeling scared, guilty, hostile, upset, just peed off, let's face it, they're all the kind of hallmarkers of being peed off. You can reduce that. Statistically speaking, you can reduce that by 50 to 70%, depending on which parameter we're looking at, by taking one session in an ice bath, just one. Even upset reduced by about 70%. More excited, way less. That says distressed, whatever that means, but it's a Danish study. I presume that's a misspelling, supposed to be distressed and interested up. This is something I felt on a personal level. So, and I've been very open about this, but I have in the past suffered from both depression and anxiety. The major things that I felt for me made a difference. First of all, what didn't work? Antidepressants, supplements, Xanax, probably the only one that worked in the short term for things like anxiety. But from a depression point of view, nothing worked for me. Nothing at all. I was never very bad, don't get me wrong. I get bouts of it, but I haven't had a single bout of depression in 10 years. Thank God, touch wood. The difference, the thing I put it down to was, and I tried everything from CBT to medications, everything. I used to take something called sertraline, which is very low dose SSRI. And looking back on it now, I know, we talked on the top of the call about how SSRIs are not much better than placebo. The fact that you're taking something and doing something about it and talking to someone about it, that can all help a little bit. But depression is, or appears to be, driven by systemic inflammation. The major contributing factor you have to systemic inflammation are going to be things like your diet, smoking, lack of activity, and alcohol. But diet is a major one. If you're eating a lot of processed refined carbohydrates, and in retrospect, I really was. So I've been on a low carb ketogenic diet now for about 8 years, and my depression is non-existent. I haven't taken medications in about 10 years for anything either. So let me talk about what I do personally, and then you guys can take your own or do your own version of it. So what I do is I do an ice bath. Usually, I haven't done one in a couple of months actually, and I've only as I start to kind of bring it together the notes and look at the most recent research on this stuff for you guys, I thought I should really get back into it again. So I have 2 different ice baths out the back. I have an old barrel, so not the whiskey barrels, but the bigger ones again that you can get from, I got mine from kind of a scrapyard. I can't remember what I paid for it, but it wasn't much. And I reinforced it with kind of a gluey type stuff on the inside because there was 1 or 2 cracks. And it actually took a couple of months for it to seal up properly and stop leaking. But that worked. And I also have a Lumi, and a Lumi is just a little recovery pot. This is basically like, it's got plastic things going up the side. It's got a little tap at the bottom that you attach a hose to. That tap works as a filter then as well, so you can turn the tap, release the gauge on the side, or the valve I should say, on the side, and just let it all kind of drain out. And it comes with kind of a soft top then as well. So I typically go to Aldi 2-3 days a week and pick up 5 or 6 bags of ice. They're about 80 cents for a bag of ice in Aldi, so it costs me like €4 every time I do it, which can add up actually over time if you're doing it regularly. This is why people have gone to converting what are they called, big chest freezers, and people are getting chest freezers, opening them up, keeping ice in them, and just kind of breaking up the ice and filling them with water, and doing that a couple of times a week to save on it. In the winter, you don't have to add ice because it gets so cold. Some mornings I've had to go out and actually break the ice with a hammer and jump in then, and that is brutally cold. But at this time of the year, you would want to fill it up with cold water and throw in 4 or 5 bags of ice. Now, the really important thing about this is when you first get to it, and by the way, it doesn't have to be expensive in terms of you'll see people spending all sorts of money on those sort of devices, like anywhere from £1,000 up to €2 or £3,000, which is crazy. I use the Lumi, I find it great. And I think the Lumi is €80 without the cover and about €100 or €110 with the cover. And I found it super, really, really good. So a couple of really interesting points before I forget to say it. The research around ice baths straight after you exercise has completely flipped on its head. The old school thing used to be, when I was kickboxing and playing soccer and any other sport for that matter, used to be if you do a really hard session, get straight into an ice bath. And that has been shown to lower inflammation, which is correct, but also blunt the positive hormonal response you get from exercises, including IGF-1, which is insulin-like growth factor for muscle gain. So it is completely counterproductive to do an ice bath straight after a hard session, believe it or not, unless you're just trying to bring down inflammation from an injury. And even that, we don't know, is that necessarily a good thing. So if you're doing an ice bath, ideally don't do it straight after an exercise session unless you've been very badly injured, and that's a different thing. You want to do it first thing in the morning if at all possible. That's going to be most in line with your circadian rhythm. I found out the hard way, just a couple of lessons from my own personal experience, that if you do an ice bath later in the day, the alertness will keep you up till 4 o'clock in the morning. Not nice. Wandering the house at 3 o'clock in the morning, wondering what the hell is going on. I can't sleep. When we first started getting into this, I say we, my wife and myself, I remember filling up a bath with ice, and it was the hardest thing in the world to force your body down into it, to get, because every cell in your body, every ounce in your being will go, get out. What the hell are you doing? Get out, get out, get out. So when I was getting into the bath, I remember just thinking, Jesus, this is absolutely brutal. My wife couldn't do it at all the first couple of times. The easier way is the hard way. So what I mean by that is fill up the ice bath and get into it in one motion, one swoop. Don't do the whole feet in and try to splash water on yourself. Just don't do it. It's not worth it. Now you're going to have a reflex where you get into the water, and for the first couple of weeks, probably the first definitely 7, 8, 9, 10 days, you're going to have the and your body just can't deal with it. And you just lower yourself in. That's gone after 60 seconds. I would go as far as to say that beyond the first 45 seconds, it's easy. Once you get in there, just 30 to 45 seconds. Anyone can do anything for 30 to 45 seconds, relatively speaking. So get yourself into the water, bring yourself all the way up to shoulder level. And if you want to be clever about it, for the first minute, don't move. If you move, whatever chemical reaction happens in the water, it's way harder. So when you get into the water, the kind of hardcore people will move when they're in the water and get in, like go down and come back up and swish the ice around and stuff. It's brutal. Like I know if I sit in it and keep my hands like that, it's not painful at all. And as soon as you move your hands, whatever happens on a cellular level, it is freezing again. So give yourself 45 to 60 seconds. Try not to move. And then after the first minute or so, if you want to put yourself through the trauma of it again, start moving and you get even more of a shock. I started off with kind of 60 seconds, worked my way up to 2 or 3 minutes, and comfortably do 5, 6, 7 minutes now. I'll normally do kind of 3 or 4 minutes, but it gets easier as you go along. So it's not like I'm saying, aren't I amazing? I can do 5 minutes. It's easy. After the first 60 seconds, it's easy. The first 60 seconds is murder. Every part of your brain is saying, get out, get out, get out. Now, once you get about a week or two in, you will genuinely, and I mean this, you'll get to a point where not only do you not fear it, you kind of look forward to it. I'm at that point now where there's an element of hesitation, but my brain is going, I'm really looking forward to doing a nice bath tomorrow morning. Tomorrow morning is my next day on. Really, really looking forward to it. So it's not like you enjoy it, but it's like an exercise session. That's a good analogy, actually. Is that coming up to it, you're kind of like, oh, do I really have to? And this is going to be painful, and it's going to be a little bit of discomfort involved. Once you get into it, you actually really enjoy it and you love the feeling afterwards. It's very similar to finishing an exercise session and knowing I've done something great for my immune system, for my health, for my mental health. And the sharpness and cognitive visceral feeling you get after it, and the uptick in mood is tangible. You can really feel it. So that's my little bit of science for today. If anyone has any questions, pop them in and I'll get back to them straight away. I don't see any questions at the minute, but give it a go. That company is no affiliations with them. They just happen to be a local enough company. I think they took a couple of weeks to send it over. Sorry, don't go with Lumi because they've had a massive stock delay, and I think they're like 3 to 6 weeks for delivery. You'll find something very similar on Amazon.co.uk. There's loads of like spin-offs of this company now as well. Daniel is asking, how practical are ice baths? How does one take an ice bath every day if you don't have a garden or a balcony? Would jumping in the sea do the same thing, and how often do you do them? Yeah, great question, Daniel. You can do it anywhere at all, actually. So you don't necessarily have to have a garden or a balcony. So if you were in a apartment setting, for example, I've seen people, now this is not ideal, but just if you were trying to adapt, I've seen people do Lumi ice baths in a shower. So basically fill it up in the shower. You have the valve facing the drain, and get in, fill it up with the ice from Aldi or wherever you want to pick it up. Aldi's just very cheap. It's 80 cents for a big bag. And you could do it 2 days a week, 3 days a week. That would be loads. Would jumping in the sea do the same thing? Yeah, for sure. 100% it would. And how often do I do them? I try to do them every second day, but broadly speaking, I usually hit about 3 ice baths a week. I try to do them every second day, but it's usually about 3 a week. Okay, guys, we'll leave it at that. Thanks for your question, Daniel. Have a good day, and we will be back again next week. Don't forget to like and subscribe as well, and just click the little bell notification if you get any use out of these podcasts, and you'll get notified when we go live. Have a good day, enjoy the sun, and I'll see you guys soon. Take care, everyone. Bye-bye.